Welcome, Kaija Saranto, an honorary member of IMIA International Medical Informatics Association Nursing Informatics Group. Kaija is going to share her personal experiences in this interview. I am Dr. Heather Strachan, also an honorary member who has known Kaija for many years. Welcome. Kaija, would you like to briefly describe the journey you have had in informatics to us?
Thank you, Heather. My background is in perioperative nursing. I assume that my interest in computers started when I worked in operating rooms with various devices, which I regarded as helping me strengthen patient safety. Of course, patients were the core of my duties. Still, I felt very comfortable surrounded by multiple machines. After clinical work, I graduated as a nurse educator and supervised nursing students in perioperative care as an educator at the nursing colleges. In late 1980s, the Finnish Ministry of Education decided that information technology should be taught in each vocational college in Finland. To my surprise, I was elected from the College of Nursing in Helsinki to participate in the education program established for the teachers. Our group was multi-professional, and it was surprising to see how common our challenges were when learning computer science at the university. The ministry also had compiled a joint curriculum for each area of study to teach a founding course in IT. So I started teaching nursing students IT with a new curricula. As a detail, the first version of the curricula also contained a course in programming, which very soon was taken away as the teaching hours were not enough for that topic. I was fortunate to work closely with hospital IT departments, as it was essential for students to have real-world experience using computers in healthcare. And that was the beginning of my health informatics journey.
That's really interesting. I think you often find that it's people that are comfortable with technology who take very easily to nursing informatics. Can you describe, Kaija, what areas of informatics that you've worked in, given that informatics is quite a wide topic area?
Yes, the beginning of my informatics journey is based on education duties, which I found very interesting, to combine nursing and IT. Although I guess my students were not that eager to learn IT in the early 1990s. However, I was so proud as the colleges of nursing, first in Helsinki and then in Porvoo, had brand new IT laboratories. The lack of software was a minor hindrance in teaching and learning. Although information systems were used in healthcare, the use of EHRs by nurses in the clinical area was not so every day. So we focused first on essential tools with the students when we had the classes. As an educator, I became interested in nursing informatics research to gain more knowledge. I first made my master's degree thesis evaluating the differences between paper-based and computer-based learning, not that much difference though. And after that, I wrote my doctoral dissertation about the outcomes of education in nursing IT. I was very eager to engage nursing informatics into nursing curricula. My interest in teaching and research led me to the university as a faculty member. I was involved in establishing the first master's degree program in Health and Human Services Informatics in 2000 at Kuopio University, which is the present University of Eastern Finland. The first group of master's degree students was exceptional, as the number of applicants was over 400 for 24 positions. So this described the field's importance more than 20 years ago already. I was elected as a full professor in 2006, and some 300 master's degree students have graduated from the program. 2011, the first doctoral student graduated from the program, and 24 doctors have graduated by 2023. For many years, I also lectured in continuing education and development projects about introduction to health informatics and nursing documentation. For instance, the importance of standardized terminology, data security, and data privacy. The professionals in healthcare and in human services, IT departments, and companies were eager to learn and focus on things they did not have time for in their daily work. The international education project have been eye-opening, and it has been gratifying to visit and host international teachers and students, for instance, from African and European countries in Finland.
That's really interesting. So you've really taken an educational approach and a research approach in your career, and I think you're right. Time is the one thing that everybody's very short of, isn't it? But yet education is so important to save time in the long run. Thinking about your the people that you've come across in your informatics journey, who have been the people that have inspired or mentored or traveled with you on your informatics journey? And perhaps you've clearly inspired a lot of students, I think but have you inspired or mentored people as well through your informatics journey?
My greatest inspirer in Finland was adjunct professor Marianne Talberi, who introduced me to the field as a doctoral student. She had an excellent library at her home with scientific journals and proceedings, which she lent to me. My doctoral studies were somewhat challenging, as almost all the materials I used in my thesis were in English. Thus, it was very early decided, together with my supervisor, Professor Helena Leino-Kilpi, that my public defense would be in English. It was not the standard procedure at that time, and I was so lucky to get an opponent from USA. Professor William Holzheimer participated as an opponent in my public defense at the University of Turku. Marianne Talberi also led me to San Antonio in 1994 for my very first nursing informatics conference as a doctoral student. Since then, I have participated in each face-to-face nursing informatics conference. It has been a privilege to acquire knowledge and make friends from the NI community around the globe. Since San Antonio, my dear colleague Anneli Ensio and I have joined our efforts to make nursing informatics visible in Finland. We shared the materials from the conferences and books edited by, for instance, Marion Ball, Evelyn Hovenga, Susanne Bakken, Susanne Grob, Catherine Hanna, and many others. Not to forget Dr. Virginia Saba, who later had a unique role in our nursing terminology work in Finland and was appointed as honorary doctor of the University of Eastern Finland in 2015, as Dr. Patricia Brennan received the same honor in 2022.
Yes, I think you've highlighted the importance of the IMIA-NI conferences and the people that we've met over the many years as being both influencers and people we've been able to share these experiences with. I would certainly recognize many of those people as hugely influential in my career as well. What do you think, Kaija, the biggest challenges that you've faced?
I think that I can perhaps mention what has been the rewarding aspects, and I go back to the program, the establishment of the master's degree program in Health and Human Services Informatics, and especially its accreditation as the first internationally was very critical to the whole IT field in Finland. We desperately needed experts in development centers, ministries, hospitals, social services, and IT companies. Professor John Mantas has mentored me all these years, and Professor Ari Hasman has given us good advice on how to lead a program which still is one of a kind in Finland since 23 years now. I'm also very proud of my master's and doctoral degree students who now work nationwide in critical management and development roles. It has also been very gratifying to follow the digital transformation in healthcare and social care as a member of many working groups in Finland. Finland was among the first European countries to have a health information technology strategy in the 1990s. I believe this critical document helped our national development work remarkably in the 2000s, when the origin of a standardized EHR was defined in Finland. As a European, I have the privilege of working with many colleagues from many countries. My very first contact with the European nursing informatics colleagues was in Swansea, Wales, UK, at the European Summer School of Nursing Informatics, organized by an active group of educators, for instance, Derek Hoy, Nicholas Hardiger, and Hans Springer, who invited colleagues from USA, for instance, Sue Bakken, Patricia Brennan, Judy Murphy, and Diana Skipa, to mentor us in the field, mainly focusing on nursing language and digital tools. Partly parallel to summer school in the late 1990s, a terminology group was established in Europe beside developing the ICNP. The group was famous for the acronym ASCENDIO, which described the Association of Common European Nursing Diagnosis, Interventions and Outcomes work. Dame June Clark from the UK was the first chair, and I had the privilege to chair the Ascendio until 2013. I already mentioned San Antonio, an important city, in 2002. At the IMIA conference, I got an idea to have a nursing informatics conference in Finland, and in 2009 we had the conference in Helsinki. With the support of the Finnish Nurses Association, the conference had an essential role in inspiring nurses in the field. We had an excellent program, but most importantly, the weather in Helsinki was perfect for an international conference, midnight sun and 28+ degrees Celsius. As the current chair of the European Federation of Medical Informatics Education Working Group, I'm also involved in the EFMI and IMIA accreditation committees to advance the implementation of the international recommendation to teach biomedical and health informatics at various levels of PMI education. I am also grateful to be part of the Biomedical and Health Informatics International Community, serving on the International Association of Medical Informatics Board as the current president of the International Academy of Health Sciences Informatics has been very gratifying.
So it very much sounds like you find it very rewarding to share knowledge and experiences and meet colleagues. And I'm sure there have been some challenges along the way, but much more rewarding, it sounds. I suppose my final question really is, what advice would you give the next generation of informatics nurses, Kaija?
Yes, but as you mentioned the challenges, I would also like perhaps name some challenges in during my journey. And that is that the pioneering role is not easy, especially in establishing a new education program in the academic world, if I consider my experiences at the University of Eastern Finland. The university management processes and administration had been somewhat rigid. Still, I think that the IT systems development made my life a little bit easier as the university management became more familiar with their IT systems and understood the benefits and the need of electronic information processing also in healthcare, which was my focus. During the development period of electronic health records in 2000s, being the only nurse in the group was very challenging. However, I had excellent support from nurses working in the clinical area when convincing the need of a standardized record also for nurses. I also think that nurses' voices are not heard when developing information systems and tools for virtual care in healthcare. So I genuinely hope nurses' opinions will be more powerful and they can participate more in the development processes. Overall, my international colleagues' knowledge and experiences immensely helped me in challenging situations. I could always email them, express my tough questions, and get excellent answers. So I'm really grateful to my international colleagues for their support and guidance.
Sorry.
And in terms of the advice for the next generation nurses, I think that as the field is evolving so rapidly, it's evident that nurses need continuous education and support in each of their roles. I also encourage them to participate actively in whatever new roles and tasks they are offered concerning future care. Please make yourself visible and heard. Today, virtual care and patients' active participation in care are standard procedures. Information security and ethics will undoubtedly continue to play essential roles. Artificial intelligence will generate huge potential also in nursing care. And I encourage nurses to study the field and be aware of the possibilities and the possible threats. In the middle of all this technology available, I also believe that humanity will have a great role in the future, an important role in the future.
Well, I think that that advice is hugely important. Be visible, continue to learn, and indeed support each other. So thank you so much, Kaija, for sharing your experiences with us. I think that will be very useful to the people that view these videos, and really has been very enjoyable to talk to you. Thank you so much.
Yeah, it was my pleasure. Thank you.